This is Dr. Kini from Cloudnine Hospital, Jayanagar, Bangalore. Well, with 17th November, which happens to be a preterm baby's day, I just want to enlighten to you about what is prematurity from the obstetric point of view. We are definitely the ones who try to prevent this preterm from happening. So the most important thing is that when we have our antenatal checkups, the consultant will ask you to come frequently for a regular checkup to pick up all these signs and symptoms of preterm labor. So regular antenatal work done right through your 9 months of your pregnancy is the feather in the cap for you so that you don't land into preterm labor. We all know that the pregnancy lasts for about 40 weeks of gestation. So when you first come in the first trimester, we definitely tell you that this is your expected due date, and anything happening prior to 4 to 6 weeks prior to this date will be landing you into prematurity. Now, what are the signs and symptoms that you can look for and tell us in advance and then come to the hospital if need be, so that we can avert this unwanted episode of preterm labor? Labor starts with the patient experiencing pains, maybe with a little bit of discharge of 4 waters and a spot of bleeding here and there. So each lady will have their own symptomatology, and when they find that the pains start from the back and start coming to the front very rhythmically, then you know that you're getting into labor. Some people have or experience rupture of membranes, which you call as the bag of 4 waters giving way. And this is another symptom which you should be careful about, that it does not happen during the course of your second trimester, third trimester. So when you have these symptoms coming in, pain, bleeding, watery discharge, please don't sit at home. Get to the hospital with your records so that somebody will see you and immediately initiate treatment. Most of the times you can have a false alarm, and this could be false labor as such. So once the doctor examines you, does a check per abdomen, checks the baby's fetal heart, and does a vaginal examination, we know that whether you're getting into impending labor or not. If there is dilatation and effacement, which are the signs that we elicit, or you find that the membranes have ruptured and there's a leak of water that takes place per vagina from the external os, well, we tell you that yes, you are getting into labor, and we would like to prevent things from going wrong. So the first and foremost symptom what a lady experiences is pains. These pains can be initially painless, but they get stronger and get more exaggerated. They start from the back and come to the front very rhythmically, very frequently, with the intensity increasing every minute. So when you have this symptom, please don't sit at home. False labor pains are ones which come very erratically. They come and they go, and they do not last for a long period of time. You find that you have some amount of discomfort, maybe you're constipated, maybe you've got some loose stools, you may have a stomach upset, and these cramps that happen, you may think in terms of labor, but that's not labor. Labor pains start from the back, come to the front. Start from the back, come to the front, very rhythmically and very much on time. It's never in disarray as such. So when you find that you're uncomfortable, wait and watch and see what happens for a couple of hours. If things are not settling down, don't do home treatment, get to the hospital. The earlier you get there, the better it is for you and for your baby, which may be going in for preterm labor. So once you're in the hospital, we work you up properly to see that you don't have any impending infection. We get your bloods done, we get a scan done, we find out the amniotic fluid index, and if the membranes have ruptured and the cervical canal is opening up, then well, you are in definitely true labor. We try to arrest the labor with the array of drugs that we have got. Depends upon what gestational age you are at, what is your parity, any comorbidities like hypertension, diabetes, twin gestation, IVF pregnancies, polycystic ovary, pregnancy-induced hypertension. There are a majority of things which can cause for anybody. So always prevention is better than cure. So please get to the hospital. Don't do self-medication at home. Quite a few ladies take it for granted. Yeah, I know about it and I know how to manage it. So they try to drag it on, and when you come to the hospital, it may be a little too late. Well, if the membranes are ruptured, we can't hold on to that pregnancy. We have to terminate the pregnancy, whatever gestational age you are at. We take some prophylactic measures in the form of giving steroids to the lady 12th hourly or more frequently, and try to get the baby out mostly you will land into a C-section because we don't want the process of labor causing trauma to the preterm babies. So most of the times when you find that the cervix is not adequately dilated, we take you up for an elective or an emergency C-section, well planned, so that the NICU is updated, the neonatologist knows what's happening, we have the ventilator standby, and all these things, keeping things in order, then we go ahead with a surgical procedure which is very, very safe for you. Maybe depending upon the baby's weight, the outcome will definitely change. Number two, if you come too late, well dilated, well effaced, and sometimes you rupture the membranes where the baby's head is on the perineum, we may not have enough time for you to be taken for a C-section. We may give a normal delivery vaginally, but taking care that the baby doctor is at hand. And we in Cloudnine, we do that. We have a team which works in synchronization, see that everything is taken care of, and see that the baby gets the best of everything. So very important to have a team which backs you up, the people in the labor room or in the theater, plus the consultant pediatrician, neonatologist, gynecologist, obstetrician, and a good nursing staff which will be able to handle the preterm baby. Getting the baby is a simple job, but looking after that preterm baby is a Herculean task. So here is where the staff comes in the NICU. They are a patient lot who do a fantastic job and looking after the newborns, who may be little less than weight, but proper care and handling will pull them through with the least of complications is the morale or the SOP of each NICU. Whether it's primary, secondary or tertiary, we definitely can salvage babies to the best of our capabilities. So we want, having gone through pregnancy, some of them precious pregnancies like IVF, stroke, diabetes, gestational diabetes or hypertension, we want you to be a happy customer at the end. So the NICU staff, the NICU, the neonatologists, all work in synchronization to see that the outcome is good enough for you to take a little one going home peacefully.